Jaime Lehfeldt with Montana Equine, and I'm going to talk to you today about spinal manipulation in horses. So the whole concept of chiropractic work in horses is that we're looking to reestablish movement in the joints. And I do that, and I palpate every joint, go through with the horses, and see if there's any tension or areas where the bones aren't moving. A lot of times you'll see the horses will be kind of antsy and they're trying to figure out what I'm doing as I'm palpating them, because I'm in their space a little differently than what we usually are. But then as we work through that, you'll see them relax and you'll see their eyes soften. A lot of times they'll lick and chew, and you can see that they're actually having some release from that experience. And then again, I'm palpating to make sure that that joint is moving better. So I'm just going to work on River here. He's an 18-year-old Appaloosa that is having troubles with going forward and acting up when he's ridden. So every joint is critical, and that includes the TMJ, right here where their jaw is moving. And a lot of times we can adjust that, and you'll start to see that these horses are better under saddle. They're accepting a bit more. They're able to bend more through their whole body. And they really do start to enjoy their job more completely. We want a horse to be able to bend through their neck as well as their rib cage. And as I'm asking him to bend his neck, I want it to be accurate bending. I don't want it to be something where he's tipping his nose to come around to his shoulder. So I want his ears to be level all the way around to the point of his shoulder. If he can't do that, then I know that he has restriction somewhere in his neck, either on this side or on the right side. You can see in the neck, a lot of times when they have areas that need to be adjusted, they'll have what we call tension lines, where the muscles are compensating and they're tight, and our goal is to get those areas to relax. One adjustment is not going to fix that, but what I usually talk to the client about is doing stretching exercises and bending in a correct way that helps that horse develop their muscles more properly. With him, he's definitely tight through his sternum, through his thoracics from T1 to T4, and both shoulders. So this is something that I've talked to the owner about, that we'll just see how the adjustment goes. If it doesn't help, then we'll look at it from a lameness perspective. Another important part of the chiropractic is looking at saddle fit, especially when we have horses with asymmetrical muscling over their top line, prominent withers, or ones that have no withers at all. Looking at saddle fit is a very important component to that, and if I have horses that are sore in their withers, repeatedly that's something that we'll address. We ask our horses to do a lot of bending through their rib cage, and if horses are restricted in their ribs, it makes it very hard for them to bend the way that we want them to. So if your horse feels like a board, it probably has some issues with chiropractic adjustments and needs some adjusting. There are some different stretches that I have clients do after an adjustment, and a lot of times it'll be mimicking some of the movements I do, but it helps their muscles to relax so that they have better movement. And this horse is really stiff on this right side, and you can see how he doesn't want to move in that circular pattern with this limb at all. So I'll have the owners doing exercises where they'll do circles in each direction and then bring that leg forward to do a toe point, and then back to stretch his back. And if you see him, he's already changed quite a lot with his demeanor. Now he's just standing quiet. He's not fighting and trying to get away, and he's quite relaxed. One of the other things with him is just the bending of his neck. If your horse doesn't want to look around at you and has some troubles, you can see that with him, he doesn't want to bend very well. He may have some arthritis in his neck. And with the chiropractic work, what we're trying to do is to get those joints moving better to hopefully prevent arthritis from occurring, or at least manage them if they already have it there. To let the horse move, because the horse is communicating with me when they're moving away. If something hurts, they want to just leave, or if they change where they want to leave and then all of a sudden you can see them just relax and they want to just sit. So the other part of the adjustments that I do is I go down the back. This is one that is really fun because the owners can see this happen. So when I go down, I'm palpating each dorsal spinous process, and I want to have movement. I want that back to bounce a little bit, and you can see that with him. His back actually feels pretty darn good, and it moves as I bounce. And that's the whole concept with spinal manipulation or chiropractic work, is to have movement in our joints, and we want the correct movement. Well, if you have any questions about chiropractic work, spinal manipulation, please give us a call at the clinic at 256-0123. Or if you just have questions about whether chiropractic work would help your horse with behavioral issues or training issues, please call us.
Thanks.